When you look at the kinetics of the outbreak, the patterns that are going on now, even as we speak, they were not going to reach a peak and turn around the way we wanted to within the time frame that was originally estimated. So I thought it was prudent and I think the right decision to extend them another 30 days. Because what you really want to do is you want to start seeing some flattening out and turning around of the curve and it coming down. It wasn't doing that. If you look at New York, it was doing this. If you look at New Orleans, it was doing this. Detroit is certainly going to start doing that. It would not have been a good idea to pull back at a time when you really needed to be pressing your foot on the pedal as opposed to on the brakes. There are a number of factors that are going on at the same time. One is the number of new cases per day. The other is the number of deaths that you have. So if you have like 100 cases today, 200 cases tomorrow, 400 cases the next day, 600 cases the next day, you are clearly going in the wrong direction. You don't want to interfere except to try and suppress that. If you reach the point where the number of new cases start to equilibrate, so that yesterday you have 150, today you have 150, tomorrow you have 125, they're starting to level off, which is the kind of the beginning of the turning around of the curve of it coming down. Deaths tend to linger a little bit more after the hospitalizations, but when you see the new hospitalizations start to do this, you know you're going in the right direction. And we weren't doing that. And we felt that if we prematurely pulled back, we would only form an acceleration or a rebound of something, which would have put you behind where you were before. And that's the reason why we argued strongly with the president that he not withdraw those guidelines after 15 days, but that he extend them. And he did listen. I mean, the president, his first, as he said multiple times at the press conference yesterday, his first goal is to prevent suffering and death. And we made it very clear to him that if we pulled back on what we were doing and didn't extend them, there would be more avoidable suffering and avoidable death. So it was a pretty clear decision on his part. You know, we showed him the data, he looked at the data, and he got it right away. It was a pretty clear picture. Dr. Debbie Birx and I went in together in the Oval Office and leaned over the desk and said, here are the data. Take a look. He looked at them, he understood them, and he just shook his head and said, I guess we got to do it. Because from a public health standpoint, we felt strongly that it would have been the wrong decision to pull back. We are scientists, physicians, public health officials. We're not economists. We're sensitive to the idea that the economy could suffer. But it was patently obvious, looking at the data, that at the end of the day, if we try to push back prematurely, not only would we lose lives, but it probably would even hurt the economy. So you would lose on double accounts. So to us, there was no question what the right choice was. I believe, looking at the dynamics now, that if we really do pull a full press on the mitigation, and importantly, if we get the areas that are spiking now, New York, New Orleans, maybe Detroit, get them under control. But as importantly, there are a number of areas in the country that have relatively few cases. Those are the ones that are vulnerable and dangerous to go along and then spike. So at the same time that we're concentrating on the ones that we're mitigating, the New Yorks, the New Orleans, you've got to look at those other areas and make sure you very vigorously identify, test, concentrate, get individuals who you take out of society because they're isolated and do contact tracing. If you just look at those and say, there are very little infections in this area or that area or that area, we don't have to worry about it. You're making a big mistake because those are timbers that can turn into big fires. So you got to do both. You got to mitigate the ones with obvious trouble, but you got to stop the ones that are starting to spark. If you look at seasonal flu, we had a bad season in 2017-18. We lost over 60,000 people just in a seasonal flu. This is clearly worse than that. So I would not be surprised. I don't want to see it. I'd like to avoid it. But I wouldn't be surprised if we saw 100,000 deaths. Well, there are cities outside the New York area. For example, the cities in New Jersey, Newark and places like that. In Connecticut, Fairfax County, Greenwich, Los Angeles, perhaps. Cities in the Midwest, some of the larger cities. Those are the things we get concerned about. Because thus far, they seem to be doing well, but they have the potential to get into trouble. I think it's very important, because what you want, if you're going to immediately identify, isolate, and contact trace a person so that you could quickly get them out of society and stop spreading other people, you want to test that you know the answer right away. One of the problems with tests that you get back several days later is that you generally let that person who might actually be infected to go back into society and inadvertently be infecting other people while you're waiting for the result of the test. So if you really want to do what I mentioned just a moment ago, is to really get the handle on those areas where they don't have a lot of infected individuals, where you want to effectively identify, isolate, and contact trace. You want the result of the test in real time. You want to know exactly what you're dealing with at the time you're dealing with it. Well, you'll never know if a drug is really effective unless you compare it to something, and that's called a randomized controlled clinical trial, where you can compare drug X and standard of care with just standard of care alone. We have a test of a drug called remdesivir that's undergoing a randomized controlled trial. We have about 200 people in that trial. Hopefully in the next few weeks to a month or so, we'll be able to get data that will give us a definitive determination as to whether or not the drug works and whether or not it's safe. Well, I'm fine, I'm healthy, I'm tired, I don't get nearly enough sleep as I should. This is not my regular voice. I'm constantly briefing people, talking, testifying, doing interviews. It's a long day. I work pretty much hours anyway, but I'm getting only about 4 or 5 hours of sleep, mostly 4 hours of sleep a night. There's a lot of things to do. When you're working in the White House, it's a very, very busy place.